Oh, that's so good. Yeah, you were limping.
Yeah, it's fucked up. Bad. Yeah. Yeah, I was messed up. Yeah. Anyway, I'm pretty good. I'm just like battered from training. So I've got like, you know, couple of like kind of sore in elbow. I think that's a combination of like golf and bench pressing.
Mm-hmm. Yeah.
So I've gone back to benching just because I've got to beat everyone else in bench press. That's kind of the
Nice.
little thing we're going with at the moment with the boys.
Yeah.
So I got a little bit of pain in here. I just got like real tight shoulders. Like this one kind of clicks a little bit if I like just lift it up and down every now and then.
Yeah.
If I like to press it down, that's it, just pop then.
Yeah.
And then this one's just kind of tight. So there's no pain as per se, but I just feel real restricted.
Yeah.
Kind of moving around.
Yeah, cool. Well, we'll have a look at how you're moving. We'll go top off if that's okay with you.
Oh, guys, in for a treat today.
Put some music over this shit.
I'll get you facing that way for me. We'll go palms forward.
Yep.
Put them that way for me.
Yep.
Keep
So
me
my
on the
body
side
doesn't
you
know how
can.
to do that.
That's alright. Yeah, cool. Whereabouts are you feeling that one?
So like front delt.
Yeah.
This side rear delt.
Yeah.
And like just my lats.
Lats as well. Yeah. Bring the arms down. We'll go arms straight out to the side for me. Come up as high as you can. Yeah. How's that one feel?
So I just get like a tiny bit of like pain in both the front of both shoulders, like just here.
Yeah.
Like there. Yeah. It's just like 2 out of 10.
Yeah.
No, it's not. Yeah. Not much. Just a kind of little pinchy feeling.
Yeah. Let's get you sitting on the table, and you're gonna turn your torso to one side. Yeah. Good. Very nice. Turning the other way.
This is the one. Oh, this side's not like.
Okay. Yeah. Start with this one.
This side's not like that.
Yeah. Yeah.
This side's my golf swing side.
Oh, is it?
Yeah.
I was gonna say.
Yeah. So all that practice, like just swinging in the house.
Yeah.
Maybe I should like try and left hand swing as well.
Well, I'll get you sitting here. We'll go palms together. Big push like that. Yeah. Anything through the forearms when you do that?
No, just a tiny bit of again 1 out of 10 discomfort. So pain in both front of both shoulders.
Okay. Yeah. Let's get you laying on your back for me. We'll go head on the pillow here. And training's been going well overall.
Yeah. Like I'm back to like 5 days training, so just beating myself up.
Yeah. Nice.
But yeah, training's going good.
Good. Working towards anything in particular at the moment?
Oh, apparently we're doing a photo shoot, so I've got to be in decent shape for that.
Oh yeah, when's that meant to be?
When is it, Tam? May 21st? Something like that. I don't know. I kind of set myself like end of April, and then they were like, we're doing it in May, and I was like, more time is always better.
More time is good, yeah.
So that's kind of the plan.
Yeah. Do a bicep curl for me. Anything with that one?
Nah.
No,
nothing.
And then I'm just going to move you around a little bit.
Yeah.
Anything through the elbow when I do that?
There.
Yeah, at that end range.
Yeah.
And then just make a fist for me. You're going to tilt your knuckles up towards the ceiling. Anything when you do that?
No.
Cool. Anything when I turn you that way or that way?
I can't feel anything.
Cool.
No.
Good. And you haven't been getting any like pins and needles or anything? No,
I don't think it happens like when I train like chest or like today, anything where I train the elbow joint.
Yeah.
Like I trained arms just this morning.
Yeah.
I feel a little bit and then it goes away. But,
Okay. Yeah, it doesn't linger like through your day to day.
No, I won't feel it like when I'm sleeping or anything like that. It's just like workout, probably 2-3 hours afterwards. If I play golf, same thing, 2-3 hours afterwards.
Yeah.
All good.
Mm-hmm. Are you left-handed or right-handed?
I'm right-handed.
Yeah.
Have
you got much on today?
Nah. No, not really.
Awesome. Just gonna check in through your lap. Cool. All good with needles today?
Yeah.
Sweet.
It hasn't been a problem in the past.
Amazing.
So I know that when that happens, usually good things happen afterwards.
Yes.
No matter how painful it is.
Makes it all worth it.
Yeah.
Cool. So we'll do a little bit of release and needling through the lats. We'll work in through sort of your mid-back around the shoulder blades as well. A little bit up into the traps, and then we'll get stuck into the pec from the front.
Yeah.
And if you're up for it, we'll do a little bit of needling through that left forearm to help with that elbow, if that's okay.
Always up for it.
Always up for it.
Yeah.
No, I feel like
the more battered you get in this session, usually the better you end up coming out of it.
The more you limp out, the better.
Oh, tell you what, last time
that was like one of those times I was like, I don't think I've done that to Jason before. I was like,
I had to like carry my leg like as I walked each step to pull it up.
Yeah.
It was pretty crazy, but it was very effective.
Good.
So that and being a good boy and doing my exercises. Who would have thought doing the exercises after the treatment that you get told to do? That's tender. Keep getting the swings in.
Yeah.
Oof. This one tickles.
Have you been watching the Full Swing show on Netflix?
I watched the first 2 episodes.
Yeah.
So I'm between that and the Drive to Survive series.
Yes.
I just haven't had enough. Yeah, I just haven't had enough time to sit and watch. All of it. Just binge it. Yeah, the weekends have been hectic just with other stuff. Interesting how to make a documentary about golf.
Yeah.
Yeah, because I already watched the golf, so I don't know if it's that exciting because I already know what happens.
Yeah, that's true. If you already know the outcomes.
Yeah, I know this dude wins this tournament.
Yeah.
Yeah, but it's still cool to see the other guys on the tour.
Yes.
They don't get paid unless they make the weekend, and to be on tour, it's super expensive and stuff.
Yeah, definitely.
And then just the practice that goes into it. So the needles do what?
So they have a few different outcomes. So one is that it creates micro trauma in the area, and that micro trauma can bring blood flow into the area and sort of all of the good chemicals that can help with healing. So it creates a little bit of local inflammation, but then that brings in all of those healing chemicals. And then they've also found that in areas where we've got a trigger point or a knot, there's a buildup of a particular chemical in the body, and when we twitch the muscle or make it twitch, that helps to flush out the excess of this chemical. Right. So it kind of resets the tone.
So it just loosens it up a little bit or something?
Yeah. So usually we feel relaxation in the muscle quite quickly afterwards. You can feel a change in the muscle tone. But because it does create a little bit of that micro trauma, and we get some big contractions through the muscle, it can feel like you done a bit of a workout afterwards.
I can attest to that. Can you search by feel where those trigger points are?
Yeah. So we'll sort of work our way along a muscle, and you'll feel for an area. Sometimes it'll feel like a knot, which people are kind of familiar with, that, almost like that ball-like sensation, or just an area where there's more resistance. And sometimes you'll know from assessing the client's movement, you'll kind of know where to look anyway, based on what areas are restricted. Because if we've got a tight area within a muscle, it's going to affect how the muscle lengthens and shortens overall. So
not always kind of looking for the place of discomfort, obviously looking at the movement. And then kind of working back from there.
Yeah.
Many times I've been to a place and it's this hurts, and then they just go just elbows in on the side of the head.
Yeah.
It's this is killing me, and it doesn't really feel like it's that effective sometimes as well.
Yeah, you have to kind of go to the root. A really interesting spot is infraspinatus, which is on the sort of the bottom 2/3 of the shoulder blade, which when there's trigger points in the area, when we press on them, we get referral to the front of the shoulder. So sometimes people will have anterior shoulder pain, but it's actually something happening at the back of the shoulder.
Yeah, it's wild.
Which is always really
shoulders are just aren't shoulders just the most frustrating thing to diagnose?
Yes, absolutely.
It seems there's so many things that cross over that complex.
Yeah.
It's just so shallow and does so much.
Yeah, and a lot of the tests that we use, orthopedic testing, they're not the most discriminate. You can get pain during one test, and it's kind of test for this, but it could be this as well.
So many other things,
Yeah.
So is it more a process of elimination and then just a logical, not guess, but a logical hypothesis of what something could be?
Yeah. You sort of put together when the pain started, if they've had like an acute onset, like they've felt it like mid-session or mid-rep, then you're sort of able to, that kind of helps you out a bit. And then you combine like how they're moving, what movements cause pain.
Yep.
Do they get pain when they're activating a muscle? Do they get pain when we're just like passively moving the joint? And like sometimes like if someone comes in with like a lot of pain, you might think it's like one area, but then once their like initial pain has settled down and we've dealt with like what's going on around the main injury, then it becomes like a lot clearer.
Yeah.
It's a lot more obvious. But yeah, especially in the shoulder, we can get a lot happening.
What's the most common thing you treat with lifters? Is there like one thing, or bicep tendon?
Yeah, bicep tendon is a big one, especially as we get closer to comp. Like if someone's moving through a prep, once that load increases, typically within like the last sort of 4 to 6 weeks is kind of where I see it really ramp up.
Yeah.
Which we kind of, it's always a bit of an interesting like process because you kind of have to like manage the load, but you also want them to progress in their training. So it might look like changing things outside of like their 3 main lifts. And then from there, like once they've competed, then the goal is, okay, how do we stop it from happening again? Because usually if it's not addressed, it's just going to come back in the next prep.
Yeah, of course.
So we've got to get right to the source of it. Yeah, sometimes you get like elbows is probably another common one, which usually comes back to the shoulder as well. That's typically where it's coming from.
I guess your elbow can only do 2 things, really. 3 things.
Yeah, it's when it tries to do other things and
so
we get into a bit of trouble.
Beaten up. Do you think that people should get treatment only when they are presenting like symptoms of limitation and pain, or is there like some preventative measures that like can be done from just like, you know, doing something like this? It's just like, oh, this is a little bit stiff, and it's like, you know, you just do this and that, and it kind of prevents the problem.
Yeah, definitely prevention, like through hands-on work, kind of a combination of your hands-on and exercise prescription can be quite beneficial, because hands-on, when we pair it like with our exercises or our, you know, our movement preparation that we're doing in the gym, it helps us get more out of like our rehab or our movement prep. So like if you were just to get like hands-on work but then not do anything outside of it to help things, then like we're not going to get too far. But if we can combine your hands-on and like unlock a bit more, whether it's, you know, unlock better mobility, better control, because we're able to move better, maybe some areas that are tight, you know, have had the chance to chill out a little bit more, all of those sorts of things, that can be super beneficial. Because sometimes like pain's usually the last thing that's going to come on. Pain and discomfort are the last thing that's going to come on. So if we can get on top of maybe any like restrictions or issues like in the area or in the body before they become like an issue that you really notice, then that's always a good place to be in.
I just find like sometimes, you know, you can put a massage ball on your back, you can lean against the wall, like in this instance as well, but it's like it's just not the same as kind of just getting the treatment done like manually. Yeah, definitely. It's just like it can definitely help to like manage things over time, but I just find that the manual treatment is just like a concentrated, way more effective kind of treatment. Yeah, definitely. And I think with that, like people probably tend to like foam roll or massage ball where it hurts, or where they notice that they notice the tightness. It's a natural thing to do as well. Yeah, right? Yeah. It's like this hurts. Like put this on it. Which really makes no sense when you actually think about it. It's like that's the cause of the pain. Well, that's not the cause of the pain. It's just like it's hurting for a reason. Like something's causing it to hurt. Yeah. This is the best spot. Like this is that spot where like it doesn't matter how painful it is, like you know it's good. Yeah.
Well, if you guys were here last week or last time we got treated, I was like, what, jumping off the table or anything? Yeah. I was squirming and screaming, and it's
Yeah, hamstrings are like that, especially because we need it like right up near your sit bone. So
yeah, it was a first, and hopefully a last.
Right, so this one can be a little bit tender.
Heard this before. That means it hurts, guys. A little bit tender means this is painful. Oof.
That
was a good one.
That's really good.
Yeah. I found like if I work with somebody in the past that hasn't worked with a lifter, they're just like one like really surprised that you pull up okay like 1 or 2 days later.
Yeah.
And then two like kind of more wrap you up in cotton wool.
Yeah.
And like don't do anything kind of mentality. It's like but I do everything like 5 days a week I'm in the gym.
Yeah.
And you're telling me to do the complete opposite.
Yeah.
It's like one that's gonna be really hard to do. And then it's like two, like we are gonna recover faster because we train more, we eat more, we move more, like we're stronger. Like so just find like sometimes like who treats you is really important based on like do they actually know what your background is and have experience with those people,
Yeah, absolutely. Yeah, because it is very different, I guess, like a lot of that, again, management, like outside of the treatment room, like the advice that we give, how much we can like adjust things.
Yeah, it's like the soft tissue, like the treatment work is kind of the same. It's just like your muscles, you don't. But it's more, just like afterwards, it's like, just take 3 days off and whatever. I'm like,
no.
3 days off? Like, no. Like, if someone told me to take 3 days off now, I'd think, like, I'm busted. Like,
I've done something really bad.
That's right. Yeah. It's not, like, I'll take it easy, do something, like, tomorrow. And maybe just stay away from the upper body kind of thing.
Yeah.
Yeah, it's just kind of, I feel like there's a lot of people that get stuck in that trap and they just don't know. Like, because they don't know that there's people out there that work with lifters that treat them differently.
Yeah. Yeah, like it always comes back to that movement is medicine. Like we're meant to move. The idea of like treatment is getting you moving better. So
that's it.
Get you back as soon as possible. And even
you're just grading the exposure, right? So it's like the intensity is just what you have to grade, not the movement itself. Mm-hmm. So don't move is silly, but move, but just do it less intensely. Yeah, makes way more sense. Yeah, it's probably gonna help with the mentality of the lifter, the psyche of the lifter as well. Like telling them they can't go to the gym is like basically telling them that they can't live their life the way they want to. Yeah, exactly. Like if it's something like like a bad ankle sprain or something where like okay we can't train lower body the next day, but it's like but still going to the gym and let's just do upper body still following your same routine. Still, especially like for a lot of people, if like the gym's like they're being outside of their outlet or like their social, a big part of their social life, like you don't want to take that away from them because that's just gonna make them miserable. My lat's just like super tight. Is that
super tight? Yeah.
Like again, just that going back to that like manual treatment thing. Like I can lie on a foam roller. I can stick a whatever broomstick with a ball on top of it in there. I can hang off a pull-up bar. It's just like it's just not the same. No, there really isn't. So then if you're smashing your back two times a week, 20 sets a week, whatever, it's like probably need to just get this manual work done as well as all your other kind of day-to-day stuff. Maybe I will keep benching the program, Tam. Keep Allie looking after my lats. Fine.
If you decide that it's part of your goal, she's going to have to work around it.
Well, that's it. We heard it. We've got proof now.
Yeah.
My goal is to bench more than all the boys. That's it. All of them.
How are you travelling with it so far?
Well, 2 weeks in, not doing too bad. I think about 105 for 5. I think it's not too bad. Nice. Yeah. I think my last bench PR was like 130 for 1. Yeah. Yeah, so we gotta beat 130. Yeah. And then it just has to be more than everyone else's. Like, I'm just gonna be that old dude with a big bench. That's it. It's just like
that's all you do in the gym.
Yeah. Do you want me seated?
Yeah, I'll get you sitting there facing that way. Let's have a look at your rotation. So arms crossed over, we'll go to the right first. Yeah, cool. Over to the left. How's that feeling?
Yeah, I can actually do it.
Amazing. With you sitting, we'll go palms up, bring your arms up as high as you can. Yeah, Coming back down. Let's go arms out to the side. Come up as high as you can. Good, yeah. That's better that way. Yeah. So in terms of forward, do you often do like your like lying shoulder flexion or like your lat stretch with elbows on the bench?
I don't do that one.
Okay.
It's more just, I forget.
Yeah, that's cool.
I just usually do, like I'll usually foam roll this, I'll kind of get bend and I'll kind of stretch and stuff. But, I can definitely, do that. Probably stretch my triceps as well.
Yeah, just like through that whole chain there. So with that one, like just kneeling down, elbows on a bench, let the chest sink down. You might feel it like a little bit through the thoracics as well. Can mobilize in through there. And then I would just hold for like 10 breaths, and with each exhale, just try and get...
Do I need a dowel to do that?
Yeah, dowel is good. I mean, you can do it without the dowel, but you just have to be extra conscious of like pulling those pinkies around. Whereas the dowel is like that good feedback of like just grip the dowel.
I can do that. I can do that.
Amazing.
Easy.
Yeah, because out to the side's good. We'll keep working on that.
Yeah.
Any issues with your training, golf, anything like that?
So low bars back in, elbows are okay.
Okay.
This is a thing.
Yeah.
Limiting golf a little bit more than what I was. Just from like volume through the legs, to be honest, like calves and stuff. Like that's enough. There's a little bit of a warning, but no pain yet.
Okay, good. Let's go. Bending forward, try and touch your toes. Yeah, come back up for me. How does that feel?
Fine. Hamstrings are tight, but
yeah. Let's go hands on your hips, leaning backwards. Try and arch through your lower back. Anything with that one?
No. All good.
And then we'll go palms facing forward for me. Keep coming up as high as you can. Yeah, how's that feeling today?
Yeah, so that side feels...
Yeah. Does it feel like the restriction's coming from anywhere in particular?
Yeah, like lower thoracic?
Yeah.
Yeah.
Yeah. I agree. This side's sort of a little bit further down.
Yeah.
Let's go arms out to the side. Yeah, how's that one feeling?
Crunchy.
Yes. Okay, you're sitting on the table for me. We'll go arms crossed over your chest and turn your torso to one side. Lovely. Turning the other way. How's that feeling?
Yeah, same spot.
Yeah, in through this area. Yeah. I'll get you to look down towards your legs. Any pulling down the back with that one?
No, that's fine.
Okay, and then looking up towards the ceiling. How's that one?
It feels like I have to force up.
Okay,
makes sense. Like this is, like my chest is pinned down.
Yeah.
So my neck will move, but...
That doesn't want to expand. Yeah. Just take a deep breath in for me. And out. Cool. How have you been feeling through the traps? Tight.
Yeah. You actually had the gun on that one yesterday?
Yeah.
Yeah.
Yeah, cool. So we'll work through both sides, like we'll work through the lat, mid-back, traps on this side. We'll do the same thing on the right side, but on the right side we'll get stuck into your traps with some needles and your lats as well, just to go that little bit further with it. And then we'll work in through the pecs, see if we can get in through here. That was a good one.
How much is it effectiveness for the needling versus like easier to get into them with your hands?
It's a bit of both. So it's definitely effective, and there's good research to back the dry needling, which is really cool. Like at least through who I studied with and the way that we needle. You can definitely be very specific with the needles. So I can, like for example, with the traps, like I'll be able to feel if it's more your anterior traps that are tight or posterior traps, and then I can choose how I want to needle. So I might needle from the back, or like if it felt like it was more anterior traps, I'd needle from the front. Same with the glutes. Like you can be really specific about what glute you're on, like whether you're creating that change in glute max, glute med, glute min, or like all three. So it allows you to be quite specific and get a bit deeper, because say you're trying to create change in glute med, you still have to go through, depending on where you're needling, you still have to go through glute max. but you can focus it in on glute med, whereas like if you stick your elbow in the area, like you're basically just pushing on glute max.
Yeah.
We find that the tissue tone changes pretty quickly, which is great. But it's a bit of a combo of both, and like to save your hands as well. If you're seeing lots of clients each week.
Yeah. So outcome wise, you're just trying to change the tension.
Yeah. So when we've got tightness in the muscle, it affects, like it can cause pain, but it can also affect if you're trying to create a little bit more movement in through the area. At uni, my lecturers would say like a normal, like good muscle tone should feel like a bag of custard. Mm-hmm. Tight muscle will feel like overcooked meat. So we're trying to go for custard.
Yeah.
That's the aim.
Yeah, I think the needling I've had like prior to you girls was like needle goes in and they would like spin it or unspin it. What's the difference between like that method and this?
Yeah, that's a good question. I've only ever learnt the way that we do it. Like the people that Laura and I studied with, this is sort of their method where it, you're always going to move the needle around in the area. I think their main, like the overlap of the methods is both methods still create micro trauma and can, by causing like a little bit of discomfort in the area as well. Sometimes it can almost like trick your pain receptors and improve your pain that way. But once we start to move the needle around and really aim to create the twitches, like that's what we're, with the way that we needle, that's what we're trying to do.
Yeah.
By getting the muscle twitch, that helps to release the trigger point and flush out buildup of any chemicals in the area that are causing that muscle to stay contracted. Mm-hmm. Yeah, I'm not too sure of like the mechanism behind when they just like leave the needle in there and maybe move it around a little bit, but similar overlap in that causes a bit of micro trauma, causes a little bit of pain, but then the difference with trying to create a twitch is you're really trying to like flush out excess chemicals and get that trigger point release. Because we sort of assess, like we'll move up and down a muscle and try and find like the tight points within that muscle, which might vary from person to person, where I think as far as I know, like other methods, there's kind of just areas that you would put needles in, like they're kind of, I guess, consistent person to person.
Yeah, so I think she used to explain it like it was either a directional thing or like a specific thing that they would do, like turn a muscle on versus turn it off.
Oh, yeah.
So it's like if something was underactive, they'd do this. If it was overactive,
oh, interesting.
But I never got the sort of relief that I get from this one. I was actually really hesitant to see Laura because I was like, needling and cupping, like, whatever. It's bullshit.
Yeah.
That was 3 years ago. I'm still seeing you guys.
Yeah.
How dependent is the outcome on that follow-up work?
I would say the follow-up work is probably even more important than what we do in the session, because like it's the stuff outside of the treatment that's going to like maintain the results of the treatment, and it's going to help create like more of that long-lasting change. Whereas if we're getting treated and then we're just going about our training or our day-to-day life the exact same way as we were before, it's likely that whatever is causing the issues, we're probably just going to keep doing it and we're just going to end up in that cycle. Whereas whether it's, doing your exercises because say you sit at a desk or something like that, breaking that habit of like sitting for 8 hours, we're going to get up and do your exercises during the day. That's going to create a change. That's going to break a habit that might be contributing to your like pain or injury. With lifters, if it's movement preparation stuff, we're preparing the body to like train better and handle our load better. Whereas if we're not doing that, we're probably just going to keep doing the same thing.
Yeah, I think the way, because obviously send online clients to you guys as well for online consults, and like the pushback is always like, yeah, but I just feel like I need a treatment.
Yeah.
Would I be accurate in saying like, outcome wise, I think it's over 6 weeks, the outcomes are basically the same?
Yeah.
That initial like release of pain is probably improved.
Yeah. I think before I like got into osteo, and even before I started doing online consults, I was probably like, oh, like how are they going to go without like the hands-on, just because people have such a response to hands-on. Like there's something about like, you know, someone caring for you and caring about your injury and providing like that relief and that real, I guess, instant relief as well that we get. I was kind of like, well, what kind of outcomes are we going to get just because you take out that component of it, which, yeah, a lot of people kind of, you know, hold on to. But, yeah, and have really good results. Like, Emily, for instance, like, we had a consult, few check-ins, like we're able to diagnose it like within 5 minutes and then tailor her exercises to that, and then yeah, so far so good.
Emily's a really good example, like in the middle of fucking nowhere.
Yeah.
To find an allied health pro that actually works with lifters and is encouraging of like I think when I sent her to you, she'd been to a GP and was just like, wear a brace and stop lifting weights for a bit.
Yeah.
Like, well, that's not really gonna solve the issue.
No, so, it's just gonna band-aid it.
Yeah, for people who don't have access to like that hybrid of someone who understands programming and volume and intensity and technique and all of that as well as their job. Yeah.
I think like confidence for you guys as well.
Yeah.
As coaches, knowing that like the person gets it.
Yeah. Yeah, and also like you're doing the right thing.
Yeah.
I just had one recently, one of my clients like had an SIJ flare up. And like the report that I got from her physio was like, these are the exercises we've given her. And they were because of this, this and this.
Yeah.
And I was like, I looked at my warm-up protocol. It's just like, I'm targeting all the exact same thing.
Yeah.
It's just like, we needed a regression of them.
Yeah.
Which suggested probably the execution wasn't great, which again, a limitation of online is like, no one sends you their warm-up.
Their warm-up, yeah, that's true.
Which is good learning for me. It's like, not everyone, particularly in the powerlifting space, is going to execute a dynamic warm-up as well as they would. Because I kind of flipped my thinking. I was like, well, instead of lying around on the floor, let's do more dynamic stuff that's going to target the same shit.
Yeah.
But it's so dependent on execution.
Yeah.
It's like, for example, instead of, I know you guys use like the clamps and stuff for glutes. I was sort of like, well, if I do a reverse lunge into high knee, like you've got hip extension, you've got challenge to the glute med and hip stability, all of that in one drill. But if they're just kind of like
going through the motions,
lazy with it and not actually getting that extension and hitting strong positions and stuff, it's like they probably actually need that regression. Yeah. And then that's obviously contextual in the absence of pain as well. Yeah. I think once there's pain involved, it's like move further down the regression chain.
Yeah. Alright, I'll get you laying on your back for me.
So in terms of the cracking adjustments, pros, cons, and obviously you don't use them.
Yeah. I think they definitely, based on like how I learned at my uni, like we were learning based off like the most recent research, which was it meant that we were sort of learning a newer method compared to like the years that had gone before us. So that was cool that it was like based in the research, and they have found that there's evidence to suggest there's improvements in range of motion, reflexive muscle relaxation, all of that sort of stuff, a little bit of pain relief as well.
Yeah.
But I find that, at least in my experience, I don't do manipulations very often. When people are quite tight, you have to release
the muscles around the area anyway to get a good, like sometimes people will be too tight for you to get like the forces that you need, at least like the way that I was trained. Like there'd be some people like who, if they come in and they're like super stiff, it's gonna be like, well, your muscles are gonna stop me from getting the change that I need to. So you kind of, by working through the muscles anyway, I find that you kind of get that change anyway. I don't use a whole lot. There are definitely osteos who do. I know osteos who love it, but I think just because I didn't do a lot of it coming straight out of uni, and I've just found that the techniques that I sort of gravitate towards work anyway. Yeah. And sometimes as well, like I find with manipulations, like getting people to like relax their body as well is always a bit of a challenge. Like
if you're frightened of it.
Or even like sometimes I'll have clients who've had manipulations before, but they think like they just can't relax their body, and then like it's not going to happen anyway. So I'm like, we'll just do stuff that you can just relax, you can chill.
Yeah. You're a lot more, gentle's probably not the right word, but less aggressive, say. Even like compared to Laura, like you said, like walk out of there, you just felt like you've gone 12 rounds. So the instant relief isn't the same. It's usually the next day that I'm like, fuck, I feel bad. Different approaches and understanding like gets still achieving the same outcome but through different strategies.
Yeah, definitely.
Yeah. Do you find you have like really different responses from different clientele as well?
Yeah, like some clients will be sore for like 3 days.
Yeah.
Sometimes. Some clients will feel like significantly worse afterwards, which you always have to prepare people for, because you never want people to think that like you've fucked up basically. So it's always really important to like set those expectations and just like check in, reassure that, you know, that's okay, like you know, that can sometimes happen, and usually it's just because they've seen you for the first time, their body's not used to it. Like I've got some clients who like hate dry needling, like I don't dry needle them. I've got some clients who pull up really rough from cupping as well, because like you know, there's a lot of changes to circulation when you do that. So it's kind of like finding like obviously like the techniques that you know are effective for like whatever they're presenting with, but also tailoring it to them. So I always like to check. Sometimes it's a bit of a laugh, but like I always like to check what people have on for the rest of the day, because like if they have to do something in particular, or you know they've got like their final singles before comp or something like that, like you've got to take that into account. They still need to be able to walk properly when they walk out of the treatment room. Alrighty, I'll let you stand up when you're ready, no rush. Come up as high as you can for me. Nice, how's that feeling?
Yeah, it's better.
Good, we'll go arms out to the side. Awesome, hips not even. Still a little bit clunky through there, but even just doing like your W reaches might like iron that out. We'll just have a look at your rotation as well. Twist over your chest. Oh, that's nice.
Oh, wow.
Amazing.
That's new.
So good. And then just have a little go at your extension, or just that little chest lift. How you feeling?
Yeah, it's heaps better.
Heaps better? Yeah, cool. Awesome.
It still needs exercises into it, but definitely better.
Yeah. All of like your extension stuff will be very good for all of that.
Thank you.
Amazing.